Hi, it's me, Ingrid INFP, and today I'm going to be talking about stomach problems, and I'm going to be talking about acid reflux. This is medical ABC's and medical literacy with me, who's a licensed doctor. I'm a resident in general practice. So I'm not done yet with my training, but I do have the license to actually practice medicine. Which is weird for me to think, but it is true. Okay. Take my advice with a grain of salt because I don't know you. I cannot talk personalized about you and your medical health. I am just telling you guys things that have helped my patients, the advice that I usually give to my patients, and things that my patients have felt helped by. And this is based by my medical training, the research that I've done in my free time, and from advice from my more experienced colleagues. So let's talk about acid reflux. And this is like a super common problem. You can have any or all of the symptoms. You can have none of these symptoms that I tell you about and still have acid reflux. The most common thing is that your stomach hurts, and it hurts like pretty high up in your stomach. It might even hurt up in your breast cage, which might sometimes people have think that they might be having a heart attack, and it's actually the stomach. That's why it's called heartburn. What happens is that there's acid in your stomach and it goes up and it irritates your stomach lining and the lining of like everything that comes above it. So some people might even have pain in their throat because of acid reflux. Another thing is you might feel swollen in your stomach after that you've eaten, or you might feel nausea after eating. You might throw up, or you might feel like sour taste in your mouth, often after eating. And it can come either in the morning, but most commonly it comes during the evening, because during the evening then we go and lie down. And when we lie down, we're horizontal, and the acid in the stomach goes up. So what happens is that it goes up and it irritates. And so a lot of people have this problem in the evening or at night, and they might think that they have chest pains at night and might think that it's a heart attack, but actually it is not, because heart attacks usually don't appear out of thin air when you're lying down, okay? The thing that is most common is acid reflux. And often it's because the upper area of your stomach is too relaxed, and so the acid comes up. It should be pretty elastic and enclosed, but sometimes it's too relaxed and too loose, so then it comes back up. Often drinking undiluted coffee, alcohol, sour kind of foods like citrus fruits or that kind of thing is bad for your stomach, and it's better to try to dilute these things. Another thing is sleeping with a little bit of not being completely horizontal, maybe a little bit more pillows underneath your head end. Another thing is not eating too big meals. Better to eat a lot of smaller meals rather than one big meal a day. So that's why it's important to eat breakfast, so that your lunch and your dinner are not super huge. And avoiding to eat food that has a lot of fats, because food that has a lot of fats stays in your stomach a longer time, so that might make the acid stay active a longer time, and lead to acid reflux. So those are the regular advice that I give. There is medication for this. I use omeprazole, which is the most common one, but there are different types. Omeprazole is the one that is recommended by gastroenterologists. But there are different other kinds of medication that have bicarbonate or that are for putting a kind of cover on the stomach lining. There's something here in Sweden called Novalucol, but there are other kinds of medication. Often, if people come to the emergency room because of this kind of problem, which can happen, they get a mixture of omeprazole, anesthetic, a special kind of anesthetic that you can swallow, and they'll get one of those other medications, and it will be what they call it is a gastric cocktail. So basically, it's a cocktail, but with just gross stuff, and you swallow it, and then often it's like magic. Often it's like magic. If you actually have acid reflux, it's like, oh, wow, I suddenly don't have this terrible chest pain. So I haven't experienced it myself, but I have seen many patients go through that, and it's absolutely amazing to see. So that is the most common thing that happens in the stomach. Other things that can happen in the abdominal area is that you might have a stomach flu. Pretty self-explanatory. People throw up, people have diarrhea, all sorts of problems. Usually it goes stops on its own, but you'll feel sick for a few days and then get better. And it's often best to call your doctor and not show up at your medical office, because if you show up at your medical office, then they might send you home because you might be infecting the other people at the clinic. And we don't want that, because what if you throw up and then all of your bacteria or virus are all over the floor? So sometimes it's a bacteria. Often if it's chicken, it's like Campylobacter, E. coli, Salmonella, that kind of thing. That's where maybe you need some kind of help. Viral infections are, we can't do much about them. Basically, make sure that you drink a lot of water and get all of your fluids. And then we've got other kinds of problems that are more like acute problems, like appendicitis. The appendix is located on your right-hand side and at the bottom of your stomach, but at first it will start by your navel and then wander towards where the appendix lives. Often it's fever, often you feel really, really bad, and often you need to go to the hospital directly. So you don't need to go to the GP. But it has happened that people go to the GP because of this pain, because they don't want to go to the A&E. The treatment for that is taking it off, but sometimes you can treat it with antibiotics, actually. And there are all sorts of other kinds of problems in the stomach, so I won't go through all of them. I'll talk about gallstones a little bit. Is also kind of can be confused with acid reflux, in that it comes after eating, and it comes like a sharp pain that comes and then leaves. You know, it's not. It comes like in sharp bursts. While the pain that is from stomach often is a little bit more long term, you could say. And the gallstones don't need to give problems, but if they do give problems, then often you need to take away the gallbladder. So it's only if it actually gives a lot of problems again and again. Otherwise, the treatment is anti-inflammatory medication and opiates that you get from the emergency room. So you get it, you might be getting it IV, well, no, not IV, subcutaneously. But you'll be getting an injection because often you feel too nauseous to eat a tablet, and also you need something quick that enters your bloodstream quickly. So that's why it's an injection that you get. And that's basically everything that they do at the emergency room is they give you pain medication. You could also be getting it in suppository form, so rectally, because that goes quicker as well. And you might be receiving some of those to take home with you if this happens one more time. So that's about gallstones. If it happens again and again, you might need to get your gallbladder taken out to get all the stones out. And sometimes you can get even more complications. For example, you might get a fever, and that's also important to go to the emergency room directly. If you have blood in your stool, also check it out. It might just be hemorrhoids, and that's fine to have, and there are like creams for that to make the hemorrhoids disappear. Otherwise, there are other problems that can give blood in your stools, and blood that is red is often pretty okay to have because it's often hemorrhoids, but blood that is black is not good to have because that means that you're bleeding somewhere else higher up. And it might be that you have a Crohn's disease or you have ulcerative colitis, or if you're an older person, like older, by older I mean over 50. I have to draw the line somewhere, right? If you have over 50, then you should at least, you need to check it out at the doctor because you're entering the age where you might have colon cancer. And so we really want to check that out. Also, I forgot to mention this in the acid reflux part, but the only way to actually say for certain that you have a problem is to go through a gastroscopy, which is pretty much the most terrible thing that you can go through. So none of my patients look forward to that. It's absolutely horrible because you have to swallow a tube. Some people can be put under anesthesia to do this. But in general, you're completely awake while you're doing this. So often you get treatment with omeprazole without doing a gastroscopy, but you might need to do one. Same thing goes for if you have colon cancer or you might think that you have it, then it's a colonoscopy, and that is also not very fun because also you need to go through a lot of steps before you can actually do that. But often it's not stomach aches that you need to go to the doctor for when it comes to colon cancer. It's often like you lose weight, you don't feel good, you start losing blood, other kinds of weird stuff. But that is basically all of the stuff that's in the stomach. I'll be talking about urinary infections next time. So have a great day. Bye.